All right, looks like the gang is all here. We'll wait about a minute here just to make it officially 1:15. Okay, it is 1:15, so I will welcome everybody officially to our weekly news conference with the city of Bloomington, Indiana University Health, and Monroe County to talk about all things COVID-19 and where the current status stands. We will take your questions once we get through opening remarks as usual. Let's first go to Bloomington Mayor John Hamilton.
Thanks very much. Hello, everyone. Happy New Year. Thanks, Chuck and IU again for hosting these events and for all of you participating. I'm going to begin with the transparency, which we have done all throughout, and report that we now have 57 city employees who've been diagnosed with COVID. We share this transparency to remind people of some of the impact and data. Just to put that in context, we had one employee get sick every 2 weeks, one every 2 weeks for 8 months from April through October. In November, we had an employee diagnosed every 2 days instead of every 2 weeks. And then since December, it's really been 2 employees every 3 days, up to 57 out of our 850. I share that primarily to note this is community spread. It's one episode of the community spread that's continuing. These are not happening at work, but they're rather being brought to work. So we're still going to have to work very hard to tamp down the community spread, and it's probably going to get worse before it gets better. It is important to note our county continues to be among the handful of best counties in the state, top 5 or 6 usually on the map in terms of overall ratings. That's because of the good work of the people on this call, the people of this community working together to try to tamp this down. Indeed, state deaths and hospitalizations are down a little bit in the last couple weeks. We'll hope that's not just a holiday anomaly. We could see that change, but that is worth noting. On the other hand, as I'm sure you all know, the national deaths hit a new record yesterday, over 4,000 for the first time ever. Again, the worst 5 death days in the country were all in the last 2 weeks. Indiana cannot be immune from that. It's possible that we will see some backsliding as well. So it is so important to keep the protections, the precautions going of masking, physical distancing, a good hygiene with hand washing, and avoiding each other at all costs when sick, and just not sharing air where we can avoid that. The good news, of course, is vaccinations are underway. The collaboration and transparency on vaccinations, I know we will continue that to let the community know where that is. You'll hear more details from folks on this call. I know more directly involved with that, sharing our numbers, hitting probably 3,000 or 4,000 vaccinations a week now locally, which is exciting, an excellent start. Just in case others don't share, our 5,000 or so vaccinations to date put us at about a little over 3% of our county population. There's a little bit of apples to oranges with exact populations, but that's a little over 3% of our population compared to the national numbers as best we know of about 6 million vaccinations, which is a little less than 2% of the American population getting their first shot. So that's good, a good start, and thank goodness for the people you're going to hear from who are working so hard to make that happen. I would note, if we want to get by summer to significant community protection and community vaccinations, it's going to take 3 or 4 times that pace locally, which will depend upon 2 things. One, getting more vaccination dosages delivered, and that's mostly out of our control in terms of the national and state distributions. But that's key, is to get more doses into our community. And then the second thing is when we get the doses, to use them, to have the uptake by our members of our community As I understand, that's going very well. I know our firefighters and police officers have been lining up to get their vaccinations, and that's great. But that's how we're going to get there, is by getting more vaccines here and by getting more people to take the vaccines. Taking it is so important. That's how we're going to get out of this pandemic. So in the meantime, stay safe. Thanks for all that we're doing to help protect our community as well as we can. And I'll be happy to take questions at the end.
Okay, Mayor Hamilton mentioned that Monroe County is still among the handful of best counties, relatively speaking, in the state. Let's get the picture from the county level from Penny Caudill.
Good afternoon. You know, the exciting part, as the mayor said, is that vaccination is here, and I think that that's the big news. It certainly is not to overshadow that we need to continue to do the same things that we've been doing in terms of prevention. We are not out of the woods yet, but vaccinations have arrived to the health department, and we will open on Monday for our vaccination clinic. The vaccine, the new link, so there's a new vaccine page I think we've been talking about, people are probably aware of, and eligibility has been expanded now to people who are 80 and over. Today, and I know that some people could schedule appointments a little earlier, but it officially went live this morning. And among those registering, 21,000 people scheduled appointments in the first 90 minutes. So this is a population that is very excited and looking forward to getting vaccinated. So we are excited about that. 211 has been extremely busy. So for people who don't have access to the internet to schedule that appointment on their own, they don't have a family member or a friend who can help them navigate that electronically, 211 is available, and they have been extremely busy as well. So if you go online, if you it's ourshot.in.gov, and there's a map of the vaccination clinics, and so you can scroll down to Monroe County, for example, and you will see IU Health Bloomington, and you'll see the health department has a vaccine clinic. Our vaccine clinic is actually going to start at the convention center, and we want to give a big shout out and thank you to the convention center for providing that space for us. That is a very big gift to us, and we're very appreciative of that. So you will, when you schedule the appointment or you go in, you could schedule with IU Health as they're continuing to vaccinate individuals. You could come to the convention center, and that's where we will be for the foreseeable future. So very, very exciting. Go on there. If the online system is very busy, they will put you in kind of a waiting room until you're in the queue to be served next. So I kind of think about it as being on deck. 211 has been very busy, and so you may just need to call them back. Other agencies like Area 10 on Aging can be called as well. So the state is using a variety of people to help reach this population, and know that as the eligibility expands, we will continue to use those means to get those messages out to people. So we're excited to be able to do that. Staff this week, we just got vaccine. We are being trained. I have staff who are in training at this very moment on the Zotec platform for the registration and the vaccination portion, so that we can get all of that, people scheduled easily and do all of that. So we are hopeful and ready to roll on Monday, but I will say, please be patient. It will be new, and we'll need a little bit of patience as we get going. We expect to receive 400 to 600 vaccinations, doses for 400 to 600 vaccines each week. And as that supply increases, so will our schedule and our capacity to see and vaccinate more people. We're also looking, our plans, as I've mentioned before, include a lot of different avenues for getting vaccine out to individuals, including special populations, people who may not be able to come to us. So stay tuned for that. We will be working through that, and as we have additional vaccine available to take out, we will. Also, I want to say that when you schedule your appointment, be sure to also finish your registration. The process can go very, very quickly if you make your appointment and then you take care of the full registration. And that includes signing your consent forms and signing off on all that paperwork that you always have to do when you go. It will ask you about insurance. If you don't have insurance, that's perfectly okay. There's no cost for this vaccine, but they can bill for the administration fee. So they will ask for your insurance information. If you can provide that, that's wonderful. If you don't have insurance, that is absolutely okay. There is no fee for this. As I said, I wanted to thank the Convention Center for their generous donation of space. ADA compliant, it's comfortable, there's parking, and we're just very appreciative of that. The MCC, SC, and the library generously have loaned us some iPads for use. Volunteers continue to step up, and I'm sure I am forgetting others. The list is growing very long of people who are responding through donations of help by various means. So just want to say thank you to everybody who is helping out with that. So visit ourshot.in.gov and it will go through a checklist. If you're a first responder, if you're a healthcare worker and haven't gotten your vaccination yet, you can still schedule that. If you're 80 and over, you can also schedule. Testing. Our Morton Street community site continues to be open. We are taking walk-ins. We prefer that you schedule and register fully because your appointment will go much quicker if you do that ahead of time. But we are taking walk-ins. We are doing rapid testing, the Buy Next Now cards, for those who meet symptom criteria. So you can get your results back in as few as 30 minutes or less. So you have to meet the symptom criteria, but we do have those rapid tests available. There is a limited supply, of course, but if you are symptomatic and concerned, I would encourage you to visit the Morton Street site. We are hearing from the sites that they are starting to see less interest in testing. So I want to remind people that we have the Optum site through January. We don't know if it will go beyond that or not. We have the Morton Street site, and certainly there are other places to be tested as well in the community. So if you need testing, if you are wondering if you might be infected with COVID-19, please seek out one of those opportunities. The last thing that I'm going to say, and it may seem a little off topic for COVID, but it really isn't, and that the state changed the system that they use for birth and death records this week. They launched a new system called Drive on Monday, and it has not been a smooth transition. We have been unable to issue death certificates this week. So that, as deaths do continue, whether they're COVID related or not, this is creating a problem for some families. We want to say we are very sorry for that inconvenience, to say the least, inconvenience. We are doing everything we can on our end. The state is trying to resolve these issues. So we're hopeful that that will happen soon, but I do want people to understand that we are just unable right now to process some of those records that we would normally process. Oh, Chuck, can you show that flyer that I sent you? I totally spaced that.
I will endeavor to do so, and I forgot about it as well. So hang on 1 second.
So there is a flyer for people who are 80 and over, just kind of letting them know about the vaccine. And the other thing that I would add while you're showing that is the state is sending out postcards to individuals that also fit this category. So you may be getting a postcard, you might be getting a call from a provider or AARP or your insurance company letting you know that you're eligible now as well. And again, as vaccine supply increases and we get through this population, then new people will be added to the eligibility list.
Okay. Let's next go to Monroe County Commissioners and Julie Thomas.
Hello, everyone. Happy 2021. We're looking forward to a better year ahead. Thanks for hosting, and thanks everyone for being here, especially our media community. I just wanted to reiterate the thanks to the Convention Center for providing the space for the vaccine clinic. It's a great addition to what's going on at the hospital, and this will be a wonderful tandem opportunity to access that important vaccine. They've been great supporters of us through the blood drives, and we cannot thank them enough for their help. I would like to start out with our assistance we use CARES funding, and we have provided assistance directly to businesses and social service organizations and also taxing units in the community for COVID-related non-payroll expenses that have not been covered elsewhere. We reached a grand total now of $459,901.51 with all of those elements combined. And hopefully that will ensure that we will have a vital economy once this pandemic is finally smashed. Also a note that we are at $100,000 in township assistance funding to our residents in the community who are dealing with issues relating to shelter, utilities, and other basic necessities. $100,000 has been provided to township trustees to administer, and they're doing a great job. We cannot thank them enough, and we appreciate working with the county council to make that possible. These are tough times, and we want to make sure that we keep people as safe and sheltered as possible. And if you are a county resident, you live in a township, whether you're in the city, town, or neither, please contact your township trustee as soon as possible if you need assistance. And for those of you in the business community, social service organizations, we encourage you to go to our county website to sign up to receive grant funding for COVID-related expenses, non-payroll expenses that you need assistance with to keep things going. A huge thank you to everyone in our community for continuing to step up and continuing to wear your face coverings. We are a bit different than the rest of the state, and the evidence is there, and it demonstrates that this is the best way to proceed. And so we appreciate everyone's patience. We never would have thought that this emergency would have lasted so long, but it doesn't make it any less of an emergency. So please bear with us, and thanks to everyone who's been working so hard to get the vaccine out and into the arms of our beloved Monroe County residents. With that, I will just take questions. Thank you.
Okay, let's next go to Monroe County Emergency Management Director Allison Moore.
Good afternoon. Got several little announcements today. I'll start with our blood drives. As I mention every week, we have 2 blood drives scheduled at the Convention Center in January. They are the daytime drive on the 21st from the hours of 10 to 3, and the evening drive on the 28th from the hours of 2 to 7. The city also has a drive that is every Wednesday. So you can schedule, if you just put in your zip code, it will give you all of the drives that Monroe County has, and you can select the best day and time for you and make those appointments at redcross.org. We still have face coverings available. It has actually been something we've been very busy with this week. We've had several different residents that have contacted our office and have made arrangements to pick up face shields and face coverings, and we have those for free of charge. And you know, that 80 and older population, some of them have had grocery groceries delivered and family members taking care of them through this whole entire event, and maybe have not left their homes, and face coverings is not something that they have needed. And that could be a necessity that they do in fact have now. So if that is a need that a family member of yours has, we do offer those for free and are happy to make those arrangements to get those to that population or anyone in our community that might need protection. And so you can go to our county website at co.monroe.in.us or call the emergency management line 812-349-2546. I will stick that in the chat after I'm done for those announcements, and we can help make those arrangements. I'd like to mention that we have been receiving many calls about when am I going to get my vaccine? When am I going to get it? And, you know, we were able to release today that 80 and over population is next. We've done those first responders and those healthcare workers. And we don't get to decide who that goes to at the local level. So the state gets that decision and they push that information down to the local level, to our health department, and then they get to then administer the vaccine to those different criterias. So please continue to hang in there until it's your turn. I know that I keep getting several calls, and I'm sure that many are, and that's definitely a question that many people have. So please be respectful of our health department as they're doing everything they can to get it out and into the arms of everyone we can. And just know we're trying to follow all the rules and do the best that we can as well. And then lastly, you know, we continue to need volunteers. Ms. Claudel talked about all the different organizations that have stepped up and have helped get ready for these vaccines. I know IU Health Bloomington was able to donate some wheelchairs because we are expecting a larger need for that with the 80 and older population. And so we are trying our best to think about everything for those individuals. And it has taken lots of different individuals to be ready for this vaccine. And we thank all of those that have been able to help us and assist with the different resources that we've needed to be the best prepared we can when we start on Monday at that vaccine clinic. And that's my report, Chuck. Thank you so much.
Very quickly, there was a question on Facebook about volunteers and do we need volunteers for the vaccine clinics? If someone is interested in volunteering in some way, where do they go?
Sure, they can go to the Monroe County website, and under the health department link, there is a Monroe County Reserve link, and they can fill out that form and get any certification. It will guide them to what exactly they need to do. And once they've completed that, any training that they have will then happen, and that way they'll be prepared to start helping us.
Okay, thanks very much.
Sure.
All right, let's go to IU Health and Brian Schock.
Good afternoon, everyone, and thank you all for your attention each week here. Something as recent events unfold here in 2021, you know, it's always good to think about how we will be remembered. And I know I don't have grandkids yet, waiting on those, but when I do, I want to be able to tell them the story of being here at this place and at this time and the great work that has gone on between all those who have participated in this press conference, but all those who have done great things here in this community to protect our citizens. So I echo the previous comments around how well we are doing as a county, as a city, as healthcare, and as a county health department. Just couldn't be more proud and can't wait until 10, 20 years from now, I can share the story with those who come after us. So Happy New Year. As we begin 2021, I'd like to take the opportunity to thank those who also supported us for Light in the Fight. Several of you came to join us for that celebration of our healthcare workers on New Year's Eve to shine a light and to recognize the great work that they've done throughout this pandemic. I'd also like to express my appreciation for IU Health's team and the health department team that have now created this sense of hope that we have through setting up this vaccination clinic. This could only happen and if all of us were involved, and that's been the case here. We have hope that we will get out of this and we'll get rid of these masks and be able to be with each other in person, but this can only happen if we each get vaccinated. And with that, I want to look at our numbers. We have seen a small decrease in the COVID-19 inpatients across the region over the last week. However, I will state today's numbers are 13 patients higher than the date that's on here. So if I added in the census at noon today, we would see 13 additional patients to the count that is here currently. So I saw a question there on Facebook or on the chat maybe that said, talked about the patients and the holiday and this circulation. What do we count these infections to? And if you look at this chart, you can see where we were at Thanksgiving time, and we saw a surge. We usually see a surge 7 to 10 days post a number of increases in testing at the state. And so we've seen that both after Thanksgiving, after Christmas, and we believe we're seeing this after New Year's as well. No science to really behind it, except that we have seen these trends all along this period of time with these holiday gatherings and continue to see them. Our team continues to evaluate our resources, and we send out those numbers each week on how we're doing as caring for our patients and the number of patients as well. So related to the vaccine, I want to thank our team members and volunteers who are continuing to vaccinate over 500 people every day here in our community. I remember one day of our opening up our vaccine clinic about 3 weeks ago, and putting up the social distancing and signage and double checking our processes before we gave that first dose of COVID-19. And everyone was anxious and worried, and now it's a well-oiled machine. Those of you who have received vaccine will know that it has gone very quickly. And to date, we have vaccinated over 5,388 people at our Bloomington site and 643 at our Paoli site. I also saw in the chat a question regarding IU Health has 2 sites that pops up when you go to register. That other site is IU Health Paoli. Today was a special day as we were able to vaccinate our first over 80-year-old patient in Monroe County after the state opened up the vaccines. As was said previously, they are very eager. And so when they heard about it, they were able to get to the site and get registered. And they were able to get their vaccine today. So that was good. I do want to remind people that there are no walk-ins. We have seen across the state at IU Health hospitals, when the announcement went out on Wednesday, patients coming to us and the 80 plus population and walking up to the sites to be vaccinated. And we cannot take walk-ins. They would have to be registered. You have to register before coming to the site to be vaccinated. We have received 7,325 vaccinations from the state supply in Monroe County, and by the end of the day, we anticipate having utilized over 6,000 of those doses, which is 81%. 100% of our remaining vaccines, of course, are scheduled to be given, and those that are registered with new vaccines as they arrive here each week. Since adding the approved Moderna vaccine to our site beginning last week, like the Pfizer vaccine, we have seen very minimal side effects. The most common effect is a sore arm, similar that you get when you get other vaccines. And so this week we began to administer those second doses. And as people register and get their first dose, we automatically register them for their second dose, so they don't leave until they've been registered for that second dose to be sure that they get the full effect of the vaccine. And it's also important to note that if you get the Moderna vaccine, you will get the Moderna vaccine on your second round. And if you get the Pfizer vaccine, you will get the Pfizer vaccine on your second dose. All the plans are in place to ensure that that happens, and it's documented, and we know what vaccine you had and what you will get. And so as I conclude my remarks, I want to again thank those of you that make the choice to get vaccinated when you're able to. I especially appreciate those community leaders who have been eligible so far. And one of our outstanding community members who's been with us in this fight is Dr. Sharp, our health commissioner and county health officer. And we just thank him for leading the way and getting that shot right off the bat and as he has been a model for us in this pandemic. And with that, I'll take questions.
Okay. Thanks very much. Let's next go to Indiana University and Kirk White.
Hey, good afternoon, everybody, and Happy New Year. At Indiana University, our priority right now is getting our restart operations, re-arrival operations back up and running as the students are starting to return to the campus. At this point in time, it's small numbers because I'll remind everybody that the semester begins, spring semester begins on the 19th of January, but in-person instruction does not begin until the 8th of February. So we have some small groups coming back that have particular labs or requirements where they need to be on campus. The bulk of our students will return to the residence halls, Greek houses, and to the community starting around the 30th of January. So this week we restarted our mitigation testing and have tested several thousand of our students, faculty, and staff so far this week, as well as re-arrival testing. And for those in congregate living, once that begins on the 30th, we'll start with an instant test. And if they test positive, then they'll need to immediately get a PCR test, so we'll confirm it. In that interim period of time, they would be asked to either return home or go to a quarantine and isolation facility until we get to confirming either positive or negative on the PCR test. So this is an improvement from what we were able to do last fall. Lots of lessons learned, so things will be even more efficient to help us control the spread as we get started here in January and February. There's been much discussion about the great decision of the NCAA to have one of the venues here for March Madness. If once those dates are finalized about where Assembly Hall will be used, the planning is already underway, and the NCAA will be working directly with the state and local health departments to determine, make sure that everything is in compliance. But in reality, there will be not much impact on the community because the teams will still stay in Indianapolis and will bus down to Bloomington, play the game, and then bus back to Indianapolis. So there will be a small impact because, of course, at this point, team members, families, coaching staff, and media are the only other participants that will be involved as entrance to Assembly Hall. But again, the NCAA will be controlling all of that. We're basically providing the venue in Bloomington, but we're happy to be able to do it, and it'll provide some good recognition for our facilities and our community as a host for the NCAA. Our next level of planning priority right now is for the vaccine, as we've talked about today. The biggest push here is to make sure that we provide a comprehensive education campaign about why the vaccine is important. We really believe that we need a very high percentage of our population, students, faculty, and staff, vaccinated for us to continue safe operations for the campus and get us back up to full speed as fast as we can. But in reality, we know that that may not be until the fall. But in order to start planning and executing, we've already supplied our students, faculty, and staff who fit into those categories: first responders, patient-facing healthcare providers, and now those over 80. We're sending them emails to let them know where to sign up and when to get their vaccines and why it's so important. We'll continue to do that as we scrub our rosters as the state continues to allow additional populations to get their vaccines. Now, the Bloomington campus has been enrolled as a vaccine site, but we've not received all the approvals from the state yet. When that occurs, then we'll be able to stand up our own vaccination operation on the Bloomington campus. And at this point, our plan is to be able to offer that to our students, faculty, and staff. We feel this is just the right fit for us because we've had a chance to really fine tune the logistics of how to do this through the flu vaccination program in the fall and through all of our mitigation testing. Hopefully, if things go well, we might even be approved as an open site for the community, but those planning discussions are still underway and nothing is firm there yet or final at all. So we'll continue our work to make sure that the Indiana University population understands the importance of the vaccines, and we'll support the state and county efforts at every turn to make sure that we're working hand in hand with them and supporting them as best we can, and want to encourage everybody to get vaccinated as soon as your population segment gets called by the state. Thank you.
Okay, we will move into questions. First of all, from Dave Askins at the B Square Beacon. And I'm going to consolidate a couple here, Dave, because they're related here. So this one from Mayor Hamilton about the people staying overnight in Seminary Park. He says it seems like it's clear that they are, and a recent survey shows that at least 60 people are experiencing street homelessness in Bloomington, exceeding shelter capacity. His question: how does the city of Bloomington reconcile the planned eviction on January 11th with CDC guidelines on encampments? And related to that, if I can find here, going to Mayor Hamilton and Julie Thomas, is there anything you can tell us about an idea floated of a possible declaration of a state of emergency by county commissioners to address the combination of COVID-19 and the Seminary Park population?
Well, thanks, Chuck and Dave, for the question. You know, there's really strong collaborations going on, and I appreciate it from so many providers helping deal with some of our fellow residents who are struggling with homelessness or poverty or various challenges, and we really appreciate that. Let me be clear that it is not safe to sleep outdoors in Bloomington winter. That was made dramatically clear when we lost one of our residents to death on the Christmas weekend from exposure and cold, and it is not safe to be outdoors. So we're working very closely with our partners who provide emergency shelter and other kinds of housing, and look forward to continuing to help people get better options. We do have expanded our shelter capacity this winter. Emergency shelter beds, which are a short-term solution, and we'll continue to do that. There are beds in several facilities that are available, so we're working very closely with that. I also just want to give an acknowledgement of the incredible work of those shelters. We were really worried, I know, all of us, at the beginning of this outbreak, and there, so far as I know, there have only been 5 cases of emergency shelter residents getting positive diagnosis for COVID. So they've just done a fantastic job of protecting people in what could be risky situations in the shelters. So really appreciate their work on that. I'll just note, since the reference to the CDC guidelines was made, the CDC guidelines do not say anybody sleeping outdoors or any encampment should stay. They say if there are no other options, if there is no place for people to go, and an individual determination is made, that sometimes can be right. But that's very different if you're in Phoenix, Arizona in warm weather versus a cold climate like this. And if there are indoor beds, they're far safer for our population. So we'll continue to work on that, and appreciate so much the collaboration from other governments, nonprofits, and funders and others.
That follow up on the potential state of emergency for Julie, you wanted to speak to that?
Sure. Thank you so much, Chuck. So just to reiterate what the mayor was saying, we are indeed part of this larger coalition of providers, including, and with many thanks to the Community Foundation United Way. Rather than having a large number of people trying to attack the problem, in different ways, the efforts are being coordinated at the community level. And I think that's what's really important. And the county's doing everything we can to support that effort. And we've worked on a number of different ideas to assist, and we're running all of those through that group because we don't want to do anything that runs counter to the services they're offering and the plans that they have. I will pass it, if I may, to Ms. Moore, our Emergency Management Director, to talk about that aspect of it.
Thanks, Commissioner Thomas. Yes, I'll just add, I've done a lot of research just this week on the possibility of declaring a disaster due to the encampment and the pandemic all tied together in one. In all honesty, that is not something other than the disaster declaration that had already been filed due to the COVID pandemic. There is no necessary additional filing that needs to be handled. It is something, as we continue to proceed with the task force that we already have and the numerous community partners that are working fearlessly to fix this problem and to assist where it's needed. As we continue to dive into that, if that's something that we foresee that we would need to do in order to help a non-for-profit, for example, to get a situation completed, then of course we would take the necessary steps and of course would work with our community partners to help in any situation that may deem necessary for so. At this point, we have not come across any of that, and it has not been necessary for us to continue anything additional. But my office, as well as the Board of Commissioners, are very actively involved with this task force, and will continue to work, as well as the city, to fix this problem the best that we can and help, of course, all the citizens in Monroe County.
And if I might add that we do have the Stride Center, which is on the main floor or basement of the parking garage on Morton between 7th and 8th. And if there is somebody in emergent need for warmth, or if they need emergency assistance or urgent assistance to find some resources because they are homeless, the Stride Center is welcoming those folks in. And so I just want to point that out as well.
Before we totally move off of this subject, the questions there are several on Facebook asking, do we have enough beds for those in Seminary Park? And what's the response on that?
It seems we do. And again, I think there's a army of people working super hard, and really appreciate them, who are identifying options, and if expansions are needed, to look at options for indoor space as well to help people access that. And I think it's accurate. You kind of intimated this. There are very likely, we know, people who are sleeping outdoors, not at Seminary Square, Seminary Park, and other places. And I think people are working really hard as we do every winter, to try to help make sure everybody can be kept safe. Besides the cold outdoors, there's danger of fires, people trying to heat tents. There's dangers of being in public rights of way and accidents and slippery streets. And there's all kinds of threats out there. So people are working really hard, and we appreciate all the collaboration that works together on this.
Okay. Question for Penny Caudle. Are there vaccinations available for people outside the 80 and over range who may be suffering from underlying medical conditions that make them more vulnerable to contracting the coronavirus?
The state is prioritizing as vaccine comes in, kind of who's that eligible next. So right now that is not expanded to other age groups with underlying health conditions. But you can go on their vaccine page on the state's website, and they are updating that weekly. So it will add as things change and people are added to those groups, that will be added to that, and we will expand as we can as well.
Okay. Jenny Tilley from the HT asks a question I think Brian addressed earlier about the state site showing a second vaccination site at an IU Health facility. I believe you said, is that Paoli where that is?
That is correct.
Okay. All right. Also from Jenny for Penny and anyone else. In a general sense, with the surges we had in cases throughout 2020, do you feel that those are more related to large gatherings around holiday seasons or more just community spread due to people letting down their guard on precautions? She says she's not looking for a precise answer, of course, but your thoughts on these.
My thought is it's a little of both. I do think people let their guard down, especially when they are around people that they know and they feel more comfortable with. And in this holiday season, and you know, from Labor Day to New Year's is filled with various holidays. And we tend to gather during holidays with people we feel very comfortable with. So I think it is, I think it is a multitude of things, but we really have not seen kind of large scale events. You know, it has been weddings, sometimes funerals, various kinds of services, but family, friend kinds of gatherings.
Back again to Jenny, she follows up on the locations that show up. That she says there is a second Monroe County site listed on West 1st Street. So let's be clear on what locations there are available for that.
There should be 2 sites in Monroe County for vaccine. One is IU Health Hospitals, and I'm not sure the exact address of that. And the other is at the Convention Center. And it will read Monroe County Health Department vaccine because it's a health department clinic, but the location is at the Convention Center. And as Mr. Shockney said before, you do need to have an appointment and be registered before you come.
Okay. And trying to make sure going back, Jenny says that sounds like it might be the hospital. It says Medical Arts Center, which I think is part of it. So that's right.
Yes, Chuck, that is Jenny. Thanks for the question. It's right there on 1st Street, across from the hospital. And there's plenty of good signage in the yards and next to the sidewalks on how to get there and where to turn to park your car and how to get in. Orange cones as well.
Okay. Again, from Jenny, for Brian, how late is too late to get a second dose of the vaccine before it's rendered ineffective? Are you concerned about regular citizens outside the healthcare system making it back for their second dose?
Yeah, so we started second doses today and everyone showed up. So that's good. If that's any indication, that's a good indication. The Pfizer vaccine is 21 days and the Moderna vaccine is 28. We try to make it within a 3-day window when we reschedule that vaccine. The phase 3 trials that were done on both of those didn't go any further out than that, 3 to 7 days post. We know we do not want to go earlier than that. So the recommendation is don't go earlier than the 21 or 28 days and try to stay within that 3-day window of those days. But this is a new vaccine. So we're just trying to stick to that window and you don't leave until we get you scheduled for that next vaccine. So in the UK, I know that may be coming from some stuff that's out there around the UK with what's going on there. They are stretching it out a little further so they can get initial vaccines in some of their population, but that's not recommended currently. And we're following the Pfizer and Moderna and FDA guidelines.
The question from Dave Askins, the B Square Beacon, in the queue for vaccinations, where would be the folks living in Seminary Park or other temporary shelters right now? And how would the logistics work for the second shot for this population?
Excellent question. And as we look at all these groups, it is quite the dilemma when you don't have, all the vaccine you want to get all these groups and how you do that. So we are following the state's guidance, and they have a large group that is looking at this from a logistics and an ethical perspective to determine who's next. We have to look at how much vaccine is available how many people are in those groups. We have plans to even take vaccine to shelters to make it as easy as possible to reach vulnerable populations wherever they are. And we will schedule their follow-up appointment when we give them that first dose and plan to reach them. It will be a challenge. There is no question.
I might just add a little anecdote, and Penny, I think the health department is right at the center of this, and thank you so much. We had an individual who was in an isolation shelter, the COVID isolation shelter, because they had no other place, but they refused to stay, and they couldn't be mandated to stay, and had some concern about spreading it. And over an immediate period, 23 individuals, I believe in Seminary Square area, were given a rapid COVID test just to try to make sure we're watching what's going on. All 23 tests were negative, which was great, but this community is really responding. Thank you for that kind of response. And I know it'll be the same on the vaccines, just doing the best to try to get everybody covered that way.
Okay. Question from David Wolf Bender at the IDS. This is directed for Penny or Brian. There are some reports in some states that people are not showing up for vaccine appointments, which is putting a strain on distribution as the vaccines can expire. Has this been a problem in Monroe County, and what is the protocol in Indiana if vaccines are about to expire? Are vaccine administrators told to just give the vaccine to anybody they can before it expires?
Well, I can tell you what we've done to date. So we do have a few people each day who do not show up for their time. What we do is we keep, first of all, first couple of weeks, we started walking it across the street and going up and down the hallways of the hospital and giving the vaccine to our team members who are on the front line. So that was the first step. What we're doing now, and what it seems to be in my calls that I'm on with the state, what seems to be happening now is we are getting a list of those healthcare workers and others that we can call. So if someone between 10 and 12 during the day misses an appointment, we can call that person on the list and they can come in and they can get their vaccine. Now, if they're already scheduled at a later time, we then cancel their appointment, and that opens up an appointment for someone else. And so we are using every single vaccine. Yes, we do have a few people who aren't showing up for different reasons, but we are, as soon as we see that that is a missed appointment, we don't pull the vaccine for that evening because we're doing it, a few vaccines at a time through our pharmacy, but we will call those people forward and make sure we do, as Dr. Lindsay Weaver says at the Indiana State Department of Health, put shots in arms.
We'll try to work in a couple more questions here. This is again for Brian from Dave Askins. At the rate of 500 doses a day, the back of a napkin math works out to more than a year to get just 70% of the population. So eventually the expectation has to be that we'll get vaccine from the state at a much higher rate, right? Something like maybe 3 to 4 times the rate we're currently getting it. And he goes on to say, if you calculated our maximum local vaccination rate per day given staff and sites, if we assume an infinite supply, and what would be that rate?
So I'll let Penny answer as well, but I don't know that we'll ever have an infinite supply. We will have an increased supply, hopefully. But new sites are coming on board, is planned to come on board in the future. Again, the constraining piece of this currently is the number of vaccines available that are coming to the states and coming to the local sites. So we are putting vaccines, remember, we started out with about 300 a day appointments. Now we're over 560 appointments a day just at our site. So as the vaccine comes available more to our community, just as we're adding on Monday, the health department site, we will continue to add slots and continue to grow not only the number of appointments that can be scheduled, but the number of sites that it can be delivered at going forward. And I'll let Penny also share.
Right. Yeah, just to add on to that, keep in mind that CVS and Walgreens are doing long-term care facilities, assisted living. And so again, as vaccine becomes more available and that capacity is increased, so will the ability to get it at other places. So whether it's pharmacies, we have plans for businesses. If we talked about IU being able to provide it as well to their staff. So there are plans to reach people through a variety of means, through their healthcare providers, their employee health clinics, a variety of sources. So what we need is the vaccine to be available so that we can expand those opportunities.
Chuck, if I can just add, it's common sense, but just to remind people, it's pretty spectacular that we have the vaccine this fast. And while we're not meeting the numbers that were projected in some ways, I think this community, what we hope, and we will be very transparent about it, what we hope is that we get as much vaccine as possible and we just get it out as quickly as possible. And as quick as the scientists and the medical infrastructure can get us vaccines, we want to get it into our population. And these folks are, I think, doing a terrific job, and we'll be really transparent about how much is coming in and how much is going into arms. So.
Another question, Adam Pinsker from WTIU asks, and Penny, I'll direct this at you. What is the total number of COVID cases identified in MCCSC schools during the first semester? And he says, not including online classes.
I do not have that number at my fingertips. I would direct you to the state, to the dashboard. There's a school dashboard that lists the cases that were attributed inside school buildings, right? So that can give you some information, and MCCSC has done a phenomenal job at contact tracing and handling those cases and working with our nurses. So they could certainly provide that. And I think that they have that on a dashboard, but the state school dashboard has that information by schools.
Okay. And one other quick question that comes in from Facebook, again, clarifying some location and what is happening where. Is Morton Street location performing vaccinations and testing is the question. Penny says no.
Yeah, no, it is not. The Morton Street site is a testing site, and the convention center is the vaccination site at this time for us.
All right. Well, we will be back again next Friday at the same time to answer more questions. We are certain there will be more at that time. We appreciate everybody in the media coming and everybody watching online here as well. Thanks for your presence today.
Thank you.
Thanks, Chuck.
Thanks, Chuck. Everyone be well.
Good weekend.